Hi, I'm Dr. Paul. My topic for today is spit up in infants, gastroesophageal reflux, GER, G-E-R, or sometimes people will call it GERD, gastroesophageal reflux disease. Now, this is a condition that I see every day in my practice, certainly weekly. If you've had a baby, you've had a spit up baby, 50% of infants are still spitting up at 6 months of age, but only 10% by a year, actually 5 to 10%. So this is a natural thing that will go away with time. What's going on here is purely anatomic and physiologic. Food goes down the esophagus. There's a little muscle right here, the gastroesophageal sphincter, that keeps what's in the stomach from coming back out. Imagine a balloon. If we overfill that balloon, now you have pressure, and that muscle being loose, out it comes. So totally normal. When does it become abnormal? Because parents I know are worried, and that's why you're going into the doctor, my baby's spitting up too much. How do you know if it's abnormal? Well, there's two main factors, and really this is the key. Is your baby in severe pain? And this, I see it probably weekly, at least monthly. A baby that is so irritable, there's clearly some pain, but they're otherwise healthy. And we think that the stomach acid is just irritating the esophagus to the point where they're afraid to eat. And you'll actually have parents say, I can't seem to get my baby to eat. That baby has figured out it hurts. When I eat, acid is secreted, it comes back up, and it plain old hurts. So they're starting to resist eating. So if your baby seems to be in a lot of pain, especially if you kind of get that association with feeds, that's probably gastroesophageal reflux that needs to be dealt with medically. The other one, besides pain, is weight loss. So if your baby is eating well, gaining weight, but they're spitting up, they're not in pain, no big deal. You bring them into the doctor and we notice, oh my gosh, you have a baby that hasn't gained any weight in the last month or 2 months, or they're even losing weight, that's a significant problem. They're obviously spitting up so much that they're not keeping enough down to gain weight. So how do we manage this? Now I'm talking about if you just have a spitty baby, which is most of you, you just do slightly smaller, more frequent feeds. So you don't want that balloon as full. If you're breastfeeding, maybe you do one side at a time. So instead of both sides every 3 to 4 hours, maybe you do one side every 1.5 to 2 hours. That might be one way of reducing the volume of that feed so the balloon isn't so full. If you're bottle feeding, you were giving, let's just say, for example, 4 ounces every 3 to 4 hours, make it 2 ounces every 1.5 to 2 hours. Smaller, more frequent feeds can reduce spit up. If you are bottle feeding, you can thicken the feeds. Now, you wouldn't do this for a premature infant, but for a full-term baby that's otherwise healthy, you can put a tablespoon of formula in 2 to 4 ounces, a tablespoon of rice cereal in 2 to 4 ounces of formula, thicken it, it may stay down a little better. Briefly want to touch on medical management. So those babies that really do need treatment, they're extremely fussy, in pain, or they're not gaining weight. There's medications that can be used. In babies, we don't use antacids. They are not a good idea for numerous reasons. Sometimes we'll try a medicine called ranitidine. This is an H2 blocker. It blocks the acid production from the receptor in the stomach. Those should not be used long term. There have been articles showing cancer, for example, with cimetidine long term. And then there's the PPIs, proton pump inhibitors. Omeprazole would be the most commonly used one. And these are safe long-term. I've seen them used in preemies and NICUs, in the neonatal units for those premature babies. If necessary, these can be used. But remember, this is a condition that will get better by itself, and for most of you, you just need to do smaller, more frequent feeds. Thanks for watching. I'm Dr. Paul.